Hello and welcome to Community Health Journal. We begin today at the end of life and a service at Cadlick Regional Medical Center for people facing a serious chronic disease or terminal illness. Cadlick calls it AIMS, or Advanced Illness Management Service. It's designed to come alongside patients at a time when they are in critical need of managing symptoms, helping with difficult conversations, ultimately providing compassionate and expert care at a highly stressful time. We recently had the opportunity to learn more about this important service. Meet the Cadlick AIMS team, Dr. Omar Khan, nurse practitioner Jason Pasleen, and case manager Catherine Foster. It is their job to work with patients in their most delicate time of need, when they are seriously ill, often at the end of life. It's known as palliative care, and it's a relatively new service at Cadlick.
We look at social factors, psychological factors, emotional factors, spiritual factors, which our case manager helps us with. And then the symptom management factors, my nurse practitioner and myself, we work with, as well as just talking about what the overall treatment plan is. And asking patients, okay, if part A doesn't work, what do we do about part B? Kind of thinking a little bit forward about that. And just helping them to get to that point where they're ready to either pursue more treatment or to just have their symptoms managed and be comfortable.
Dr. Khan is fellowship trained and board certified in palliative medicine. His team reaches all parts of a patient's care.
It's nice knowing that you're able to make a difference in someone's life, someone you made feel better that was having symptoms before, and now they're feeling better and they're having a more quality of life, and they're able to spend that quality time with their family. It can be a very special time for them, and I'm glad we were able to help make that happen.
I was fortunate enough to do my internship in undergraduate school with a hospice up in Alaska, and I really fell in love with the work that we did there and working with people that were facing life-limiting and life-ending challenges sometimes. And so when I had the opportunity to get on with Dr. Khan and we started this palliative care service here, I jumped at the opportunity.
Patients who benefit from palliative care include people living with serious illnesses such as congestive heart failure, advanced cancer, multiple sclerosis, kidney failure, COPD, or neurological disorders. Palliative care can begin earlier in the disease process, while hospice care is meant specifically for patients approaching the late stages of life.
The larger amount of patients that we work with probably have prognosis in the terms of years. But because their disease is more advanced, we may know that they may not be eligible for a cure or may not have a cure, although it can happen sometimes. We help them focus on the quality of life and what's going to help them get through this situation to whatever next step they decide that they want.
I think it's important for people to remember that even when someone is up against a potentially life-ending and oftentimes a life-limiting illness, that we can help improve their quality of life or retain the quality of life that they had, that there's always hope, that we never stop caring.
The AIMS team is a huge asset to Cadlick, especially in settings like the ICU.
It really is what we're about as healthcare providers. Cadlick has made the investment and the commitment to not just treat people, but to treat people as a whole being. And AIMS really is the culmination of that, is that we want to see that patients, regardless of where they are in their illness path, have the best care possible. And this team really is the group that does that.
While much of the work of the AIMS team is in the hospital setting, they see patients in their offices too, which are located at Cadlick Clinic Hematology and Oncology at the Tri-Cities Cancer Center. To work in this field requires great skill and compassion, and for members of the team, it's a true calling.
You say those words and they automatically focus on, well, I'm dying, or I don't have much time left, and that's not necessarily the case. The case is we want to get your symptoms under control. So when I tell people, when you hear the words palliative care, I want you to think symptom control or symptom management. And that's really the big message I want to get across about that. Palliative care is symptom management, and we can ensure that you do have quality of your life so you can spend that time with your family or your friends and make it a special time.
You know, my dad was diagnosed about 25 years ago with colon cancer. And he went into remission, and he, once the initial diagnosis, he had treatment, he had chemo, he had radiation. I watched all the symptoms he went through. I saw how sick he got just from the treatment itself, not just the disease. And then ultimately, when it took his life, I got an opportunity to work with hospice, coming into our home and helping us with that. I can remember something that my dad asked his oncologist. He said, my dad said, this has got to be a really hard job for you to do, to have to give this kind of news. And he said, you know, Mac, he said, I work with the most wonderful people in the world, and that's why I do what I do.
I really want our community to really understand what palliative care is about and what it is and what we can offer these patients. And how important it is in a patient's care at any point in their lives. It's very important. It isn't about, you know, forgetting about somebody. It's about focusing on what makes somebody's life that much better. And I want the community to know that we are there to help them, and we are there for them. And that you know, that we're going to be there for them through wherever their journey takes us. We're going to be there with them.
Our thanks to Dr. Kahn and his AIMS team for their time telling this important story. For more information on the service, visit cadlic.org.